So we've heard a lot about the context of reentry issues for people coming out of prisons and jails in Maryland, and to add to that, we're going to talk this next section a little bit about some of the policies in the city and state that are relevant. Just a really brief overview. And to recap, we're looking at about 12,000 adults that are coming out of prisons and jails, and it's important to note that these folks are not just being dispersed equally all throughout all parts of the state. So 60%, nearly 60%, 59% to be exact, of folks are returning to Baltimore City proper. And among those, well over a third go to 6 out of these 55 neighborhoods that are delineated. And that's important because these are the 6 neighborhoods that tend to be described as already socially and economically disadvantaged based on some of the statistics that have been mentioned previously related to percentage of female heads of households and median income and other indicators. So lots of times people will write about why adults that are re-entering these communities are having such a hard time and why recidivism is so high. Recidivism means people, after they've been released from prison, get rearrested and re-enter the prison system. So that's that 47.8%, so nearly half of people within 3 years will be back into prison or jail after they're released. Why do policymakers or decision makers care about these issues? Well, these are some of the reasons. So we're seeing more and more people arrested, and their offenses have shorter terms. This costs a lot of money, so it's a big economic issue, and as noted here, in the period of budget austerity and budget cuts for important social services, this is taking up a big chunk of the budget. It's actually in Maryland over the last couple decades the first or second budget item in terms of how much the state is spending on corrections. And then we don't see necessarily that the communities where people are being arrested and sent back to are any safer than they were prior to these higher rates of incarceration. So kind of an overview, most recent stuff that's changed, there's a lot of talk among policymakers about how to make reentry better, so how to reduce recidivism and how to help people as they get back into the communities find jobs, find housing, have access to health care and other really critical services, education and job training, for example. So in 2009, there was a bill passed that created a task force that made a series of recommendations, some of which are legislative recommendations. So you'll see those 4 small bullets in the PowerPoint slide refer to bills that have not passed but have been introduced in Maryland, among many. So there have been 9 bills introduced more recently, but these 4 are considered important. So some of them would reduce sentence time by incentivizing diminution credits, which allows people to get out earlier before their sentence is officially over. Banning the box and shielding criminal records are separate things, but the idea is you don't want to just broadcast publicly that everybody has a criminal record, because you're kind of taking the carpet out from under people when they go to apply for housing or for jobs. Employers and housing, both public and private housing providers, can deny them. So we want to kind of make this process a little bit easier for folks, at least get a foot in the door in those settings. And then the 2011 reorganization of the prison system was this recent move to shift away from divisions that are separated based on pretrial, corrections, and post-release kind of categories of organization within the public system, and move that to a regional kind of setup. So there is now North, Central, and South divisions, and they take care of all the pretrial corrections and reentry service stuff.
So in addition to some of the policies that Marce talked about that can address these issues related to reentry, there's a number of public health interventions that also can improve the health of prison populations and improve the way they enter communities, and ideally then improve the health of the communities they go back to. As Andrew already mentioned, prisoners have much higher levels of communicable disease, chronic disease, and mental illness than the general population. And so providing adequate and appropriate treatment to these inmates is essential to both improve their health, reduce the risk of transferring disease to other prisoners, prevent the spread of disease to community members once the inmates are released, and to ensure that recently released inmates don't place an undue burden on community healthcare systems upon reentering the community. To address these health problems, correctional facilities can do a number of different interventions, one being providing comprehensive screening and treatment for infectious disease, particularly HIV and tuberculosis. Another would be to offer health education and health promotion services, many of which are backed by evidence from randomized controlled trials that show that, for example, providing HIV education can improve knowledge and reduce behavioral intention regarding risky behaviors surrounding HIV. Another one is to link inmates to substance abuse treatment and mental health treatment, and that was discussed a little bit before about some of the programs that are going on in Maryland, and those can be very successful if they were expanded to reach all of the population in prison that needs them. Other interventions look at specifically at reentry, and currently in the US there's no single federal agency with a clear responsibility to help inmates returning inmates connect to community health systems, and for that reason many inmates with health problems don't have access to transitional services for continuity of care. So even if inmates are receiving care in prison, once they're released there's nothing to ensure that they will continue to receive care in the community. To correct this problem, prisons and jails have to make discharge planning a priority for all inmates. This involves, before release, helping inmates set up appointments with medical care, social services, and case management in the community to lay the groundwork for the transitions, and then post-release following up with these recently released prisoners to make sure they've accessed services and support and make a smooth transition back into the community. Again, as was already mentioned, the Maryland Reentry Partnership is trying to provide some of this discharge planning, but it reaches so few of the people, of the number of prisoners that need it, that it's not really, it's not really changing the health of the urban communities to which these prisoners are returning. And additionally, there's such an issue of any low-income communities and inmates more accessing quality health care that often limits the effectiveness of the discharge planning that does exist. And finally, without having access to housing, employment, or education, recently released inmates are also unlikely to access healthcare services. And all of this can have a dramatic negative impact on the health of the communities to which these people return. And so some of the policies that Marce already talked about, such as ban the box and shielding, can make a large impact on making sure that the services that recently released prisoners need are available to them. And thus our major recommendation here is that we need a multi-level approach to improve prison healthcare and the health of urban communities. That involves additional funding for discharge planning to make sure that the reentry program is available for any person that needs it, as well as policy changes to improve the access of employment and housing as the Maryland Reentry Task Force recommendations outline for us.